Hey, it's Jessica DaMassa with WTF Health. I'm here at Bayer G4A's signing day in Berlin, and joining me right now, I have Femi. He is the CEO of RelianceHMO. Good to have you with us.
Thank you very much.
So you are here all the way from Nigeria, and I have to say that you are one of my favorite startups in this slate. You are disrupting insurance, which is something that needs to be disrupted the world over. So tell us a little bit about your company. Introduce it for those who are watching who may not know.
Yeah, so at RelianceHMO, we're using mobile phones, telemedicine, and data science to make health insurance cheaper and easier to access for pretty much everybody in Nigeria, hopefully across the rest of Africa.
Okay, and what was my favorite part? You're also underwriting, which is the coolest thing.
Yeah, exactly. So I think it's important to us to be able to actually create the plans that work for people and not just basically reselling plans that other health insurance companies have created. So it's essential that we underwrite those plans as well.
Tell me about the plans.
Yeah, so we have a variety of plans. Our cheapest plan right now goes for about $10 a month per person per month. And it covers pretty much almost everything that each individual might need. Surgeries, simple conditions like malaria. Even for some of them, we can even extend it up to like maternity cases and, admissions and that kind of stuff. Most expensive plan goes up to roughly about $50 a month. And that covers like international care as well.
Okay, so this is, the way I understand it is that everything is mobile, right? And that through the app, you're able to do telemed for real quick things that need to be done. But if something more serious happens, you've got relationships with hospitals so that people can go. And you've got how many hospitals now?
We have 1,800 hospitals across Nigeria right now.
Okay, and how many users do you guys have?
Right now we have about 12,000 active policies. So that's people who have paid us premiums, who we cover, and we make sure that they receive excellent care, either through the app or in any of our hospitals.
All right, so tell me, I guess, for those who might not be familiar with the health system in Nigeria, how is what you're offering different than the way the health system is traditionally running? I mean, we've all got our broken healthcare systems in all other parts of the world, and we all complain about them. But I guess back up for us and help us understand the context of what you've developed. What's the health system like in Nigeria?
So I can explain that in two different ways. So first of all, if we look at health insurance in Nigeria, which is actually an underpinning for like how people access healthcare, we're looking at only about 5% of people having access to healthcare. If you compare with the US, it's like 92%, or Europe, it's almost 100% of people have health insurance. And essentially that means there are 190 million people who don't have any health insurance at all. If we're in Germany right now, it's about 2 times the size of the entire German population. And that means that almost everybody who goes to hospital is paying directly out of pocket. And the kind of implications of that are severe. So sometimes you find people who don't bother going to hospital because it's going to be so expensive. So a simple condition now becomes to get worse and worse until when they do get to hospital, it becomes even more expensive than if they had gone the first time. And then for some people who do have to go to hospital, the cost is like so prohibitive that it could lead families into poverty. In fact, there's research that shows that about 30% of families are about just one healthcare expense away from getting into like complete abject poverty.
Yeah, that is a huge problem around the world.
Exactly, 100%. And that's kind of the problem that we're trying to like provide excellent, financing structures to prevent these kind of issues from happening.
How is preventative care in Nigeria?
Preventative care is not as big as it should be. And it's something that we are also trying to focus on as a health insurance company. I think most of the healthcare in Nigeria and maybe across Africa is very focused on treatment. So it's like, you fall ill and then we'll treat you. Yeah. And even that isn't as good as it should be. But I think one thing that's, of course, not only is it economically advantageous to us to make sure that people receive preventive health care, it's also good for the patients as well, that, we're providing them with the tools, the knowledge, and even the ability to be able to prevent common conditions that could lead into.
Is it lack of awareness, lack of access? What do you think it is?
It's just basically the way the healthcare system is structured. I think we're very much, the healthcare system is still very much structured around like receiving treatment. And let me say the philosophy or the story of preventive healthcare hasn't really spread as deep into the fabric of the healthcare system as it should have been.
All right, so tell us what you're doing here at Bayer. It's very interesting that you're an insurance company here at Bayer. So tell us about that.
Yeah, so we are basically working on a partnership with Bayer to try to find interesting ways of increasing financing of healthcare and financing of top-tier medications to as many people as possible. I think what's most exciting for us is that this is probably the first time that we or maybe any other major pharmaceutical company is working very tightly with a health insurance company in Africa to find a way to get health insurance into the hands of as many people as possible. And, it's going to be exciting to see where that leads.
I am so excited for one.
I'm very excited.
I mean,
Very
truly, I
excited
am.
as
I
well,
love
yeah.
this. We don't see enough disruption and new startups in insurance. And so congratulations. Pleasure to meet you.
Thank you very much. It's great to meet you too.
Thank you. I'm Jessica DaMassa with WTF Health here at Bayer G4A's Signing Day. Thanks for watching.